Hello everyone. I'm going to be doing a post-mortem, otherwise known as a necropsy, as a demonstration today. The purpose of this video is for our students, our veterinary students, to see what a dolphin post-mortem is like. I'm going to use our specimen today is called a common dolphin. The scientific name Dolphinus dolphini, and this is a dolphin that has been stranded along our coast in the Western Cape, and it's been donated for us to use today. So I'll be going through the process with you step by step and be giving you a little bit of information as I go along on the organs. To start off with, I just want to show you what we need to be able to do a dolphin postmortem. Firstly, you need a clipboard and your data sheet to record everything. Next, you need formalin. This is 10% formalin to be able to sample for histopathology. We also need alcohol. This is 80% alcohol, and that's for the parasites if we find any internal or external parasites. And then we need sample bottles for bacterial and fungal culture samples, and these are sterile sample bottles. Next, we need our instruments to cut with. So we have rib cutters. If the animal is large, you will need that. We also have smaller ones for a smaller animal. We need measuring instruments. So we have a ruler, and we also have a longer tape measure. And importantly, we need a sharp knife. We also have some scalpel blades if we need to do small dissection, and some rope, which we'll use to tie off the intestine as we take it out so that we don't have any spillage. Important to have a permanent marker so that your samples are marked correctly. And we also have some bags if we want to take some fresh samples with some paper to mark that with. Okay, before you start, your dolphin needs to be defrosted. So often dolphins are frozen when they've been found beached. And they need to be defrosted properly before one does the post-mortem. The best way to do this is to keep them inside in a cool area, not in the sun, because that makes them autolyze much faster. So before starting to open the animal, we're going to first check that whether there are any signs or trauma or anything that can give us an idea of why the animal has died. So we're going to do an external assessment. You can see that there are some marks on this animal. There are some scratches here. And there are also some scrapes here on the dorsal side. These are important. For example, if you're worried about boat strike, you often find that parts of the flippers might be missing. So it's important to make a note of that on your data sheet. What we also will check externally is whether it's a male or female. We do that by looking at the distance between the genital slit and the anus. In males, they are longer than 10 centimeters. Between the two, you can see this is 13 centimeters. So this is a male. Females, the genital slit and the anus are closer, less than 10 centimeters. In addition, females will have a mammary slit on either side of the genital slit over here. Males can sometimes have that, so one just has to check very carefully and use that in addition to the distance between the two openings. If you find a dolphin or if you're called out to do a dolphin post-mortem, it's important to take some morphometric measurements. These help researchers to determine the types of animals, the ages, and also the gender that's being stranded. So one of the important ones we'll take is from the tip of the nose, and it goes all the way down to the cleft here between the flukes. The other important ones are find where the animal is at its broadest, and you take a girth measurement, so it's full around the body, a circumference, and then also along the back end of the animal, and then also right in front of where the flippers are. So those are the basic ones. There are more. We will have them available in the reference that will be at the end of this video, and you can then get it from those data sheets. So we're going to start by taking some samples of the skin and the blubber. It's important to check the thickness of the blubber because that gives us a good indication of the health status of the animal. We will take samples from right cranial to the fin in the same line in the middle of the body, and then in the same line ventral. In addition to that, we will take one right down below the tip of the fin. So those are the 4 samples we'll take, and we will record the thickness of the blubber there. So they have taken out the first bit, and what we'll measure is the blubber thickness, which will be just under where the skin ends down to where you start seeing the red tissue of the muscle. So in this case, the most dorsal is 6 millimeters. At the midline, it's 10 millimeters, and down ventrally, it's also 10 millimeters. And where we have the sample, that's right under the fin, and that measurement is also 10 millimeters. Okay, let's take some samples of the blubber that we've just removed. So 10% formalin, as I mentioned earlier, and remember with formalin, you want to have a sample that's not thicker than 2 centimeters, otherwise it doesn't fix properly. So we will take a sample of all 3 areas, which will be ventral, dorsal, and mid-body area. And that's about the size that I'm going to take. And that goes into the formalin for fixing and for histopathology. Next, I'm going to remove the rest of the skin along the body wall. So I'll start by loosening the flipper and the shoulder. And that's the scapula or the shoulder attached there to the front limb in effect. And then for the skin incisions, we are going to go along the dorsal area and basically meet up with these lines that we've already made for the previous skin samples, and down the length of the body, and then also meet up with the ones ventrally. And then where we've removed the shoulder and the flipper, those incisions will meet. Sometimes it's a bit, especially in a larger dolphin, these skin pieces can be quite large, so you can dissect them into blocks, and it makes it easier to remove it then, because the blubber is quite attached to the subcutaneous tissue. We are going to keep those blocks of skin that we are removing because they will be checked for parasites. And caudally, we go up to about the level of the anus because that's where we will be working until. So once we have taken off the skin, we do cross sections into it to check for parasites. So the skin that's been removed, we cut in a crisscross manner into the blubber up to the skin, and these are approximately 3 centimeters, 2 centimeters apart, and we then just open up and check whether there are any parasites in the skin. And if you see anything, if you can get a whole parasite or an adult parasite, you can take that out and put it into formalin, into alcohol. The skin sample goes into formalin if you see any lesions. You might wonder why we're only doing one side. Well, it's quite representative. If the animal has had skin parasites, it should be fairly well distributed, and doing one half of the animal, if it's there, we will find them. Next, we're going to start by opening up the abdomen and then the thorax. You can feel the caudal end of the ribs. That gives you an idea of where the abdomen starts, and basically try and lift the body wall away from the intestine so you don't accidentally cut into them. And as you can see there, that's the abdomen opened up. And then we do a Y incision, so we go along the caudal end of the ribs and then down the midway. And pull the body wall away from the intestine so your knife doesn't accidentally cut into the intestine. It's important to check for any fluid in the cavities, the abdomen and the thorax, as you open them. There is going to be some fluid in an animal that has been frozen, such as this one, and then defrosted, because there will be seepage from the organs and then also from the ice as it's defrosted. So that is normal. If you have a just dead animal, freshly dead animal that's on the beach and you see fluid, that would certainly be significant. In an animal like this that's been frozen, not as much. So the blood tinge fluid in this abdomen, I would put down to freezing and defrosting. So that's the midline, and then this is where the last rib is. So I'm going to extend this incision up, again being careful not to cut into any of the abdominal organs, right up to the spinal cord, which is running here. This is all muscle. So the abdomen's been opened up, and if you have a look here, this is the diaphragm. I'm going to separate the diaphragm from the rib cage and then open up the thorax. Bone cutters, this is quite a small animal, so smaller bone cutters are sufficient. If it's a larger animal, you will need some bigger tools for that. Try not to touch the organs as you move along. We want to open up the abdomen and the thorax and have a good sort of bird's eye view of it. And if we see any lesions, we'd like to take samples that are sterile as possible, and then only start to handle the organs. So first open up without handling or touching, and try to also keep your instruments away from the organs. So now I'm going to cut on the top. First going to just make a line with my knife, and then so we have the rib cage removed. We can sample a portion of the rib bone with some of the intercostal muscle. That can be kept for analysis of minerals, and it can be frozen, so it does not have to go into formalin. It goes into a bag, and it's just kept in the freezer then. And you can do bone ash on that, and send it off if there is any concern. So there's our rib sample. So now we have the thorax and abdomen open. As you can see, there has been quite a lot of fluid. There's also fluid here in the thorax, and it's very blood tinged. And that is often what one sees with a defrosted carcass. Move the organs around a little bit to see if you see any lesions, and if there are any points of concern, especially in the lung, you can sample it now already in a sterile bottle with sterile instruments, which I will show you how to do now. I'm going to show you how to take a sterile sample, and even though there isn't a lesion here, firstly put your forceps and your scissor into the formalin to sterilize it if you do not have sterile instruments that are in a sterile pack. So our scissor and forceps has been placed into formalin for a bit. Shake off the excess. And let's pretend that we have a lesion here, maybe an abscess in the lung. And we will sample it. And then keep the container, the sterile container, closed while you are sampling, and only once you have the sample ready do you open it, place it in there, and close it immediately, so you minimize the amount of contamination. So if we've had a lung abscess, it is now in there and it can be sent off for culture. To show you the topography of all the organs, here we have the lungs, the aorta, and if you lift up the lung lobes, you'll see the heart, and caudal to the heart along the ventral margin of the lungs is the marginal lymph node. This is the diaphragm, which is overlying the liver. These are the kidneys. Remember, dolphins have lobulated kidneys. Cranial to the kidneys, the adrenal gland. This is part of the stomach, which we will see better once the gastrointestinal tract has been removed. And then the intestines. That's the right kidney. And this is where the testes are. They are intra-abdominal, and they are fairly elongated. That's the epididymis right there. And then lastly, this is the urinary bladder. Between the two testes, also quite elongated. So they are the three organs that lie in the caudoventral part of the abdomen. We can't see the right adrenal right now, but it obviously will be cranial to the right kidney over there. As in horses, dolphins do not have a gallbladder. Next, I'm going to tie off the intestine and the stomach and remove that. So we separate the mesocolon. This is the colon. Remember, the anus is over there. So the colon is in that position, in that direction. Separate the mesocolon so that you have place for tying off. We do a double tie, and then we cut in between the two ties because we don't want spillage. Once that's tied off, we can separate the intestine from the body wall. It helps to move the intestine out of the abdomen to see where to follow. This is the mesentery coming down from the aorta, all the mesenteric blood vessels. So we will separate it there. And that's going through the blood vessels, that's why it's bleeding. This organ over here, that's the stomach, the organ right caudal to it. This is the spleen. This is the main spleen, and then as you can see, there's a little organ similar to it, same color. This is an accessory spleen, and this is a fairly common finding in dolphins. So there I have the esophagus that I have separated. As you can see, this is the diaphragm, and this is the esophagus coming into the stomach. And that's where we are going to tie it off so that we can remove the whole gastrointestinal tract. Again, two ties, and we cut in between the two. So there they are, and I'm going to cut between them, and I'll do the same caudally. The two ties that I made earlier in the colon. And now the last attachments are still onto the liver. So now the gastrointestinal tract is removed, and we will lay it out. So the gastrointestinal tract has been removed. As you can see, this is the stomach end. There are the spleen, there's the spleen and the accessory spleen, and I've laid out the intestine, and on this end is the colon. The intestine of the dolphins are quite uniform macroscopically. So it's difficult to tell where the duodenum, the jejunum, the ileum, and the colon start and end. That is something that one has to look at histologically. Just to orientate you, these are the different parts of the stomach. They have a muscular, a glandular, and a pyloric part. In the fold of the glandular and the pyloric part is the pancreas, and you can see it's this pale pink glandular tissue, and then that's the start of the duodenum from the pylorus. So I'm going to start with the sampling of the stomach, and then I will move on to the intestine. So take a full sample of the stomach, full thickness of the wall and of the different parts. This is the glandular stomach. That's the muscular stomach, and this is the pyloric area. That's the start of the duodenum. So I will sample it there. And remember, for formalin, you want it to fix, so not thicker than 2 centimeters. I will also sample the pancreas. Note that the pancreas is L-shaped, and sample both ends of it. Lastly, I'm going to also sample the spleen for histopathology. Now I'm going to sample the intestine. I'm going to take cranial, mid, and caudal. When sampling the intestine for histopathology, do not take samples that are too long because it will not fix. That is sufficient. That's cranial, mid. And I've seen a possible lesion right here, which is this black discolored area. And I'd like to sample that, so I'm going to take a sample right there for histopathology. This might be an area of hemorrhage. So once the samples for histopathology have been collected, you now open up the intestine and the stomach completely. We've opened up the intestine. There are a couple of lesions that I'd like to show you. This is the stomach. So just to recap, that's the muscular stomach, the glandular stomach. This is the pylorus. This here is the mesenteric lymph node, and then the intestine has been opened. So looking at the stomach, you can see there are these lesions. These are ulcers. Remember, when you are doing descriptions in pathology, you need to describe shape, size, pattern, color, consistency. So in these cases, you would measure it with a ruler and describe them. They are 3 or 4, they are 5 to 3 centimeters, and they are black discolored, and they are well demarcated, indented, or crater-like lesions would be a good description. The glandular stomach doesn't have any lesions in this case. And then carrying on to the intestine, I'd like to show you this animal has a really high worm burden, and these are tapeworms. And if you can appreciate the number of tapeworms that are present in this intestine. So I'm going to sample some of these, and if you can recall, we use alcohol. So we will take samples of these worms for identification, parasitology, and we can put them into the alcohol. In addition, something else I wanted to show you was, if you look at the stomach or the intestine contents, you see that other than the pink discoloration from the blood, you can see this white, sort of granular intestinal content. This is half digested milk. So this is a suckling calf still, and that is what the milk looks like when it's half digested. And the intestine in this animal primarily has the digested milk and the worms. The worms are present throughout the intestine. Lastly, I'm going to sample the mesenteric lymph node, and a sample of 1 to 2 centimeters is sufficient, and that's for histopathology in formalin. So now we have the gastrointestinal tract out, we can see the rest of the abdominal organs better. I'd like to point your attention to the kidneys, left and right kidney, and left and right adrenal, which is under. So left adrenal and right adrenal, and in this case these adrenals do look enlarged, which may be a sign of stress. I'm going to remove the kidneys and the adrenals now. I've detached the kidney up to the caudal pole, and I'm going to extend it, and you can see the ureters running from the kidney, this white paler tube, and to the bladder, which is this elongated structure here. Also check that there are no dilatations to indicate that there might be a blockage in the ureter. That's the left adrenal, left kidney, and that's the left ureter going to the urinary bladder. I'm happy that there's no lesion there, so I'm going to cut that. Same on the right. And once I get to the caudal pole of the kidney, again, there's the ureter. Okay. So there I have right adrenal, right kidney, and that's the ureter, the little tube running to the bladder. I'm happy that that ureter looks okay, so I'm going to cut through it. I'll cut into the kidneys and the adrenals to sample them and to check for any lesions. The adrenal has a cortex and medulla. The ratio of the cortex to the medulla should be 1 to 1 to 1. So it's 1 cortex to 1 medulla to 1 cortex on the opposite side. I'm going to sample half of the adrenal for histopathology. Same on the left. To sample the kidneys, I'm going to just do a mid-incision, and you can see how lobulated the kidneys are. Once I have sampled both kidneys, I will do a few more incisions to make sure that I haven't missed a lesion. I do not see anything that is unusual there. In addition, we can sample the kidneys fresh, as we did with the rib, for mineral analysis. And for that, we can take approximately 1/4 of each kidney and place it into the freezer in a plastic bag. Approximately that much kidney is okay for freezing. The next organ I'm going to sample is the urinary bladder. I've already checked the ureters. So this is the bladder back here, and it's elongated, and it's between the 2 testes. And this we'll just sample for histopathology. So I'll take a little wedge shape, and you can see there's still some urine. The next organ I'm going to sample is the liver. And this is the liver right here. The liver has 2 lobes in a dolphin, and we will sample both left and right once I've removed it. In the liver, it's important to check consistency, and we do that by making parallel incisions that are approximately 1 centimeter apart and squeezing it between our index and thumb fingers to check whether it's harder or softer, bearing in mind that it is an animal that has been frozen and defrosted, which does affect the consistency a bit and make it a little bit softer. So now I'm going to sample approximately a cube of about 1 by 2 centimeters per lobe. And again, the liver can be sampled for mineral analysis, as with the kidney, and that can also go into a plastic bag. And again, approximately a handful is a good estimate to use. And I will sample both lobes and put them together so that I have a representative sample. So approximately that much liver is sufficient for mineral analysis. Okay. Next, I'm going to sample the testes. This is where I've sampled the urinary bladder right there, and there's our left testis, and there's the right testis. This is the tide of colon over there. It is a young animal, so the testes are not well formed yet. I'll also take a histology sample for, of the diaphragm. And lastly, before we finish off with the abdomen, the last sample I will take is of the larger muscles, the epiaxial muscles. Next, I'm going to start with the thorax, and for this I need to take out the pluck. For getting the pluck out, I need to do an incision along the jaw, and it will be a V down to the intermandibular space and up the other end, remove the skin, and then I will be taking out the tongue together with the rest of the pluck. So the tongue is attached to the floor of the mouth, and you need to get it detached, and you need to cut all along the edge of the tongue and separate it from the mouth to get it out. And then while I have the tongue nicely visualized, if you look at the margins of the tongue, you see these little fronds. That's called the fringe. And in suckling young animals, this is used to create a negative pressure around the teat while they are drinking. So it in effect has a bottle teat suction effect, and it prevents the milk from the mother's teat from floating away in the water while the youngster is suckling. And this is a good indication of age of the animal. If they do not have this fringe, then we know that they are already weaned, which fits in with what we've seen in the intestine in this animal, because the intestine mainly contained, other than the worms, it mainly contained half-digested milk. So this is a suckling youngster. Now I'm going to continue removing the tongue by detaching it further. So I've separated the tongue, and this is the end of the hard palate ends approximately over there, and this is the soft palate. You can see it indents. And this is where the larynx goes up to the blowhole on the top of the head. This right here is bone. This is the hyoid apparatus, and I'm going to cut through that so that I can separate it and loosen the hyoid in order to get the larynx out. This is the right hyoid apparatus. And if you look here, this is the larynx, and that is the goose beak. It is the larynx of the dolphin. It protrudes into the blowhole, and when the animal is not breathing, it will be closed and open up, and that will connect directly to the trachea, and then from there to the lungs. Okay, I'm going to remove the whole pluck now. So I have the tongue, I have the larynx, and I'm going to separate the right lung from the thoracic wall and cut all along. Remember, this is the aorta, so I will sever the aorta there, and then I will remove it as one. Also notice how the lungs are quite inflated, and they're big. And that is also an anatomical difference to our land mammals, in that these marine mammals need to have, in order to keep their lungs inflated, they have cartilage, and the cartilage is present right down to the smaller, thinner airways, which is not the case in our terrestrial mammals. So their lungs are more spongy and they're more firm in a way, and they feel very different. They're not as soft, and they don't collapse and become atelectatic as land mammals' lungs would after they've died, and especially after they've been frozen. You wouldn't see lungs that are this solid looking and spongy. Okay, so lastly we're going to separate the heart. Is also attached to the body wall, to the thoracic wall. That's the pericardial sac, and I have cut into it already, and there's the heart. So I'm removing the heart with the lungs. And there we have the pluck, we have the tongue, we have the pharynx, we have the larynx with the goose beak, and then the trachea and the esophagus with the lungs and the heart. The marginal lymph nodes are on the ventral margin of the lungs, midway, cranial to caudal, and they are routinely sampled. Next, we're going to open up the pluck. It's been removed. I'm going to start with the pharynx and then cut open the lungs, and then we'll open up the heart. So, lifting up the pharynx, and cutting into this area where the oropharynx is. This is a sort of a cavernous area. carrying on from there, this is the esophagus, and through the goose beak or larynx is the trachea. The esophagus in older animals, one can often find little bits of fish and fish bones that they've eaten, and if you are doing foraging ecology, you would want to sample that as well to see what fish they have eaten. Next, I'm going to open up the trachea through the goose beak or larynx. And it is cartilaginous and firm. And those tracheal rings go into the bronchi. So here's the trachea, and those are the two bronchi going to the two lungs. And there is also an accessory bronchus that is the small opening right here. These animals often have lungworms, and it's important to open up the trachea and the bronchi all the way down into the lung parenchyma so that you can check for the worms carefully. So cut until you get right to the tip of the lungs, because they often sit in the smaller airways as well. And check carefully that you don't have anything, and you can cut into a few of these larger airways as well. So sampling the lungs for histopathology, you have to sample cranial and caudal, as well as ventral and dorsal. So I'm going to sample both sides, which means a total of 4 samples. Try not to squash the lung too much when you are sampling it, because it does interfere with histopathology, and the tissue does get damaged. And of course, if there are any lesions, you are going to take those in addition to these standard samples. So I've sampled 4 in total, and the marginal lymph nodes should also be sampled. And as a recap, they are midway between cranial and caudal and along this ventral margin of the lung, right there. The bronchial lymph nodes are located between the two bronchi, right at the bifurcation, and if you palpate in that area, you will find them, and they can also be sampled at this point. Next, I'm going to open up the heart. The pericardium has already been removed as I took the animal, as I removed the plaque. This is the pericardium right there. And with the heart, one opens it up while it's still attached to the plaque. Remember to cut the right heart along the edge of the ventricle and the left heart down the middle. And I'm going to cut, this is the groove between right and left, interventricular groove, so I'm going to cut all along the edge of the right ventricle. That's the atrium, the right atrium, and I've gone all the way around. This is the pulmonary artery going to the lungs. I can still see the atrioventricular valves, and they have not been cut through, so that's one valve. You will see the rest once I've opened it up completely. The left heart, that's the left heart I'm going to cut down the middle. Remember, it has two atrioventricular valves, so when you cut through the middle, you will cut between the two valves. That's the left heart. So that's the right atrium, the left atrium, left ventricle. And these are the two valves here. There's one and there's the other. So I've cut between them when I cut into it. And if one goes between these two leaflets of the two valves, you enter the aorta. So now I'm happy that I don't have any thrombi in the heart, and I can remove the heart from the lungs. So the heart has been removed from the pluck, and this is the left heart with the two valves in the ventricle. This is the aorta, and these are the aortic valves. These are semilunar valves. These are atrioventricular valves. On the right, I've opened it in a circular cut so that the atrioventricular valves are not damaged. This is the pulmonary artery. Similar to the aortic valves, these are also three semilunar valves. To sample the heart, we are going to take a sample of the right ventricle, the left ventricle, as well as the interventricular septum between the two ventricles. And again, I'm going to take a sample that is not too large so that it will fix in the formalin. So approximately a 1 by 2 centimeter sample. So that's left ventricle, right ventricle, and interventricular septum. Next, I'm going to sample the tongue, approximately midway, to take a sample of the tongue muscle. And again, it's about 1 centimeter thick. And check for lesions. And if you don't have any lesions, then a standard sample will be sufficient. And that's the pluck sampled. Okay, next we're going to remove the head so that we can get ready to get the brain out. So if you look at the right side of the animal, this is where the eye is and the right flipper is still here. Approximately halfway between the two is where we will cut to get into the first joint, or C1, the atlanto-occipital joint. Also, if you move the head up and down, you can see approximately here where my finger is, that is where the head is joined to the spinal cord. And that is where we would like to cut to remove the head. Start with the ventral part because it's easier to find the mark. And if you look in this area, I've already gone into the joint of that first vertebra. Once you have the correct spot, it's easy to continue. Once the ventral part has been opened, it's easy to extend to the lateral and dorsal part of the joint. So I'm going to move the dolphin onto the back. So now the head has been removed, and I'm going to skin this, remove the blubber, and we remove the excess soft tissue to get to the skull, to get it nice and clean before we open up the bone. As I'm cutting the mandibular area, there is a special fat right here along the ventral and lateral part of the mandible. This is called acoustic fat. So it is a routine sample, and we will take a portion of that acoustic fat. In addition to that, they also have the melon, which is located here in the cranial head, and once we've removed the skin, you will see that as well, and that's also very important. This is the opening of the blowhole, and it's in effect the nose of the animal, and it also has the ability to close. I'm going to sample the melon and collect for histopathology. As you can see with the tissue in the jaw, it is also mainly fat, but it also has a lot of nervous tissue in it. Now I'm going to try and get as much of the muscle and soft tissue as possible off the skull, so that we can get to the bone itself. So to know where to cut to get the brain out, you can see there's a bulge, and that is where the main part of the cerebrum is. The cerebellum is below that. So cut from where the condyles are towards where the jaw line is, or the jaw angle is, and then up towards the blowhole. And you're going to cut in sort of a diamond shape. It doesn't have to just be 4, you can do a few smaller cuts, but in effect you would like to get this cap off so that you can keep the brain whole and in one piece. So we've opened up the skull, and you can see the brain is exposed. So these are the fissure lines, the fontanel lines, and it shows how young this animal is. The skull has not fused yet. As you can see, this brain is very rounded, and the cerebellum, one can't actually see it at this point. It is below the cerebrum. So now I'm going to remove the brain and then show you which parts to sample. So this is the ventral view, the cerebrum, left and right, and the cerebellum. And then medulla oblongata, going towards the spinal cord, and then the brain stem over there. And if I try to move it over without damaging it too much, that's the dorsal view. two cerebral hemispheres and the cerebellum. It is quite soft because of the effects of the freezing as well as the young age of this animal. So firstly, I'm going to split up into left and right brain. There are lots of gyria and sulci and lots of folds if you compare it to other terrestrial mammals that we normally see. The left half of the brain is more intact, so I'm going to sample that. Cut through, so this is cranial, this is caudal, cut through the middle of the brain, and you will get the brain stem, and you should also get a portion of the hippocampus if you cut there. And I'm going to sample a section from the middle. So that I can include that hippocampus and brainstem area. The cerebellum, you cut longitudinally so that you can see the gyria and visualize them nicely, and that you can also sample together with the brain stem and the medulla in that area. And that's the basic samples that we need for the brain. Okay, and that's how you do a post-mortem on a dolphin, specifically for a field post-mortem. Bearing in mind that if you have a specific study or research, you will probably want to take more samples, specifically for what you want to study. But these are the basics that you would need to be able to do. And I hope that one day when you get your first dolphin post-mortem, you'll enjoy it and that this video will be handy. Thanks.